chat for December. Before I get started, I just want to wish you all the very best for the holiday season and hope that you will all have a wonderful time with family and friends, etc. We have a lot to get through today, so I'm going to start right now. The first part of my chat will be dealing with medications in general. The second part of the chat will be to answer some of the questions that were received regarding medications when we had our conference in October of just a few weeks ago that we were not able to answer on the day of the conference. And then last but not least, I have already received some questions for the presentation today, and we will get to those as quickly as we can. Okay, so medications in general. Not a day goes by when we don't get a call about medications. I have talked about medications many times in one form or another during others of my lunchtime chats over the past couple of years. So why I have chosen to discuss this topic again is because I believe that there is some information about medications that you probably don't understand. There is a lot of written information available about anti-Parkinson medications, what each drug is used for, how the drugs work, etc. And in fact, we are in the process of revising a lot of our literature, and one of the new brochures that will be coming out will be a revised and updated brochure on medications, which we would be happy to send to you if you would like to receive that in the new year. However, for today, what I want to discuss with you is some of the other considerations that go into choosing which medications to take, when to take them, whether the drug therapy is working, and when it's time for a change. So what kind of questions do we get on a regular basis? Here are some examples. How effective are anti-Parkinson drugs at relieving symptoms? What about the side effects from the medications? When should I start taking medication? How much medication should I take? So first and foremost, the aim of treatment with medication is to achieve the proper balance, i.e., treating symptoms effectively while minimizing unpleasant side effects. In order to do this, many issues must be considered. You will no doubt read information from or hear information about Parkinson's disease experts discussing and disagreeing on many aspects about the treatment of Parkinson's. But for now, most of the experts do agree about one thing, that people with Parkinson's need the gold standard of treatment, levodopa carbidopa, only when the Parkinson's motor symptoms, that's tremor, slowness, and stiffness, become severe enough to impair your daily function and interfere with your quality of life, whether that means job-related issues or recreational activities, such as your ability to be able to play golf or dance, things that you would like to be able to do on a regular basis, have enjoyed doing in the past, but are now prevented from doing because of your symptoms. Another thing we try to emphasize is that each and every person with Parkinson's needs to follow a program of drug therapy specifically designed for that individual. So I want to spend a few minutes talking to you about why a standard regimen of medications cannot be applied across the board to everyone with Parkinson's. First, in different people, different symptoms are prominent. Someone with predominant tremor may require tremor medications, while someone with considerable slowness and minimal tremor may benefit from a different medical regimen. Secondly, people differ in their emotional reactions to the same symptom. Tremor might not bother one person very much at all, but for another person it may be very embarrassing, so much so that he or she won't even leave home unless the medications can relieve the tremor. Another example of different emotional reactions to the same symptom is one person may be able to cope with the involuntary dyskinetic movements sometimes caused by anti-Parkinson drugs, but another person may find even the slightest bit of dyskinesia difficult to put up with. Another consideration needs to be taken into account in designing an individual's medication regimen is what kinds of activities the person is involved in each day. For example, someone might continue to pursue an active lifestyle with daily golf or tennis matches in spite of considerable stiffness and slowness, while another person finds the same degree of stiffness and slowness interfering with the use of a computer keyboard in his or her job. And last but not least, the timing of symptoms is important too. For example, a person experiencing difficulty getting in and out of bed at night might be helped by a long-acting medication, whereas a person without nighttime problems may require taking a drug with a shorter duration of action. So to summarize the first part of my talk today, there are many factors that go into deciding what medications are best for you and how to use it, i.e., what is your most predominant symptom? What is your personal reaction to your symptoms? In other words, which ones bother you the most? What is your lifestyle? What kinds of activities do you engage in on a regular basis? When do you need your medication to be working for you, both during the day as well as during the night? So by now, you can see how important it is for you to be able to talk to your doctor about what really matters to you. If you recall, last month I talked about how miscommunication and misunderstanding between doctors and patients leads to inappropriate treatment and consequently lack of control over the aspects of your life that are most important to you. All currently available medications for Parkinson's can only relieve symptoms. They do not prevent the condition's gradual progression. The goal of treatment is to keep a person with Parkinson's as comfortable and functional in his or her everyday life and work as possible. So, while doctors have the knowledge about different kinds of anti-Parkinson medications, which drug combinations are most effective to treat various symptoms, what options are available to choose if a drug has unacceptable side effects, etc., etc., what they don't know is you, how your symptoms are impacting you physically, emotionally, and psychologically. So you have a very important part to play when it comes to ensuring that your drug therapy is individually and uniquely tailored to suit you, and why I stated earlier there is no standard regimen of medications that can be applied across the board to everyone with Parkinson's. I realize that many of you who are listening to this chat today have been taking anti-Parkinson's medications for a long time. So some of the things I'm going to talk about now won't really apply to you. But for those of you who are more newly diagnosed, some of the following information I believe is worth discussing. First of all, anti-Parkinson medication should be introduced slowly in order for the body to adjust to the drug and to minimize the side effects. Also, by increasing the dose gradually, both the patient, that's you, and the doctor can determine the optimum dosage that alleviates symptoms, yet causes the fewest unwanted side effects. So here again is where you, the person with Parkinson's, has a very important role to play in your treatment. You must keenly observe how your body reacts to a drug and tell your doctor what you observe. Sometimes people take a new drug for a day or even just one pill, then stop taking it because it makes them feel a bit nauseous or dizzy. The truth is, individuals often have an unpleasant initial reaction to a drug, but as it is continued, their bodies become more tolerant. So what I'm trying to tell you is that given the importance of medications to individuals with Parkinson's, a drug should be given a fair trial, usually more than 2 weeks, before the decision is made that the individual cannot tolerate it. If, however, the side effect is severe, such as when someone suddenly develops confusion after starting a new medication, then the medication should be discontinued as soon as possible after discussion with the doctor. If you are concerned about symptoms you suspect are side effects of anti-Parkinson's drugs, please consult with your doctor before discontinuing the drug, as your doctor will be able to tell you whether these symptoms you are experiencing are indeed likely to be related to your medications. Establishing the relative benefits versus the side effects of a drug is not easy and should be done under a doctor's supervision. Another thing I should have mentioned at the beginning of today's talk is that, as I'm sure you've noticed in previous talks, my voice gets rather dry and raspy. So once in a while, I'm going to stop talking and take a sip of some warm tea, which I hope will enhance my ability to be able to complete my chat without too much disruption. So, sip of tea coming up. There. It is very important to be realistic about your treatment goals. Putting that another way, it is unrealistic to expect medications to eliminate every trace of tremor, every trace of slow movement, every trace of problems with your walking, or every trace of handwriting difficulty. This doesn't mean that such an outcome is absolutely impossible. However, to accomplish this with the medications currently available, such high doses would probably be needed that the risk of severe side effects would greatly increase. The general rule of thumb that neurologists use is that individuals should take no more medication than is absolutely necessary. And therein lies the problem. It is tricky to decide what is necessary for each person with Parkinson's. I have said at least once during my chat today that the goal of treatment is to preserve, people's daily function and comfort. Of course, given all the factors I have already discussed, this varies with each and every individual, even among patients with the same symptoms. So, at the risk of boring you today, you and your doctor need to work together to balance your medication, taking into account how much your symptoms are interfering with what you want and need to be able to do on a regular basis. Also, taking into account your physical and emotional comfort, what you and your family desire, as well as the untoward side effects that a medication might have. Something that I find is confusing to some individuals is why the medications that are effective at one stage of the disorder are not necessarily sufficient later on. We speak about the fact that Parkinson's is a progressive disorder, but what we really mean by this, and how does this relate to you, involves how much medication you need to take. So, in people with Parkinson's, specific groups of brain cells, called neurons, are slowly and progressively injured. and then they selectively degenerate or die. And this is the process that causes the typical symptoms of Parkinson's, such as tremor, stiffness, and slowness. In other words, when brain cells in a specific area of the brain, called the substantia nigra, don't expect you to remember that, just go with me on this one. When those brain cells in that specific area of the brain deteriorate or die off prematurely, the brain's ability to communicate with the rest of the body, and the muscles in particular, is disrupted, and symptoms of Parkinson's appear. Because the substantia nigra is the area of the brain that has an important role to play in the control and regulation of movement. Everyone over the age of 20 gradually loses brain cells throughout the course of our lives. But for some as yet unknown reason, people with Parkinson's lose these specific brain cells that I've just referred to prematurely. At the present time, we don't have a medication that will slow down or stop these brain cells from dying off. So, as more and more naturally producing dopamine brain cells die off, the dopamine replacement medication, Sinemet and Prolopa, or levodopa carbidopa, or levodopa benserazide, which is what these medications are also known as, have a harder and harder job to keep up with the cell loss, which is why medications that are effective at one stage of the disease won't be sufficient later on, and increases in dosages sometimes cause side effects. The other thing that happens is that people's dopamine systems gradually become sensitized to levodopa and other medications as well, and side effects may appear even at the dosage that a person has taken for many years. Also, because of the combined effects of medications, side effects may appear just by adding a sleeping pill, or if the person with Parkinson's develops an infection. It doesn't take much to tip the balance between alleviating symptoms and avoiding side effects. In other words, for a person with moderate to advanced Parkinson's, the line between disability and function is quite often very thin, which is yet another reason why we try to encourage people to get a consultation with a neurologist who specializes in Parkinson's. I'm going to take another sip of tea. Hang on there. Okay, on we go. Another thing to remember is that medications you may require to treat some of the non-motor symptoms may interact with each other as well as with your levodopa. Some examples of non-motor symptoms are depression, anxiety, dystonia, that's severe muscle cramping, urinary problems, sleep disturbances, and constipation, just to name a few. So what I'm trying to tell you is that some of the drugs that are used to treat your non-motor symptoms may have similar side effects to your levodopa, such as drowsiness, for example, and thus these side effects, when they're all used together, may multiply. So whenever you start to take new drugs, choose the drugs that deal with the most bothersome symptom. Begin with only one drug at a time, at a low dose, and increase it very slowly. That way, if you have an unacceptable reaction, it will be clear which drug has actually triggered that reaction. I have mentioned the word side effects several times already today, and I want to take a minute to define what a drug side effect is, as I believe there is some confusion between the term drug side effect and drug-related toxicity. A side effect is simply an effect that is not the effect for which the drug was actually designed. I think it's safe to say that most side effects are undesirable, such as drowsiness when taking an antihistamine, or yeast infections that develop during a long course of antibiotics. On the other hand, there are some side effects that are rather handy. For example, some anti-Parkinson medications that cause dry mouth, which may be bothersome to some folks, are not bothersome if you have a problem with drooling, as that side effect can help to control excessive saliva. So you can see, medications are all very complicated. Some common side effects of anti-Parkinson's medications are stomach upset and lightheadedness, which are annoying and definitely disrupt one's life. Some of the more serious drug-related side effects, such as involuntary movements known as dyskinesias, or hallucinations that seem things that aren't there, and delusions, beliefs that people are doing things to you that are actually not happening, as well as on-off fluctuations, can be best worked out by a doctor, particularly one who is experienced with anti-Parkinson's medications. So again, it is imperative to talk to your doctor and make him or her aware of what is going on. Please, 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 never adjust your medication on your own without consulting your doctor. All medications have the potential to cause side effects, and it is impossible for doctors to predict which patients will have reactions to any one specific medication. So, if side effects are so common, what is the difference between them and drug-related toxicity? Again, a side effect is undesirable, but it is not harmful. And toxicity means that the drug causes long-term harm. Levodopa, especially when used for a long time, can definitely cause side effects, but there is no evidence of levodopa causing toxicity or being harmful in humans. I think making the distinction again between side effects and toxicity is a very important one to understand. Currently, we don't have medications that eliminate or get rid of side effects, which again is why medication adjustments need to be addressed by your doctor. As I said at the beginning of the chat with you today, there are numerous factors that must be taken into consideration when a doctor is deciding which medication is best suited to you to treat both your symptoms and your lifestyle, what you need to do, what you want to do in order for you to have the best quality of life. Remember, the goal of treatment is to keep you comfortable and functional in your everyday life, your work, and your leisure as much as possible. So it is essential to communicate with your doctor. Doctors have wonderful education and experience in working with people with Parkinson's, but they don't know you, and they don't have crystal balls. So it's up to you to help them to get to know you. Now I'm going to answer some questions about medications that you have asked during the education session with Dr. Ahlskog back in October. To begin with, there are a lot of questions, so my answers will be quite brief. If you would like to have a longer discussion about medications, or if my answer to your question is not satisfactory, please call me at 416-227-3375 or 1-800-565-3000, extension 3375. and we can have a more detailed conversation. Okay, here goes. The first group of questions deal with a drug called levodopa. Levodopa is a medication that replaces the dopamine you are missing, which is the key treatment for Parkinson's. Dopamine is a chemical that sends messages from your brain to other parts of your body to help you move. And when you don't have enough dopamine, you have stiffness, slowness, and tremors. So it's easy to understand why levodopa is considered the gold standard when it comes to the treatment of Parkinson's. You may sometimes hear it called L-Dopa, apolevocarb, levocarb by itself, Prolopa, Sinemet, etc. But it's all the same basic medication, and the different names signify what the levodopa is mixed with in order to allow more levodopa to get to your brain and reduce side effects. Speaking of side effects, the next question I have here today is, what are the side effects of levodopa? I have already gone over some of these, but I think it's worth repeating. One of the most common side effects are dyskinesias. That's when a person makes involuntary, writhing, random, wiggly movements, which are irregular. And they are not to be confused with tremor, which is also an involuntary movement, but a tremor is a regular and rhythmical involuntary movement. Another common side effect comes under the heading of behavioral and psychiatric side effects, which range from vivid dreams, nightmares, and non-threatening hallucinations to delusional states, paranoia, feeling everybody's against you, agitation, disorientation, and psychosis, where individuals cannot discriminate what is real from what is not. Time does not permit me to go into detail about all the side effects, and although we currently don't have medications to eliminate side effects, we do have strategies that can help. So if you're experiencing any of the things I've mentioned today, please be sure to let your doctor know, as these things can be adjusted with treatment changes. Next question. What is the difference between immediate and controlled release levodopa? The controlled release formulations of Sinemet provide a slower release of levodopa into the bloodstream, which in turn produces a somewhat longer duration of action. However, it's important to understand that Sinemet CR, that's controlled release Sinemet, may contribute to the problem of early morning slowness, stiffness, and foot cramps because it takes longer to kick in and it is less reliably absorbed than the response to the immediate one, and one would expect by the standard levodopa preparations. So it's important that if you find that you're very slow and stiff in the morning, maybe instead of taking Sinemet CR at bedtime, it would be better to take an immediate controlled release levodopa and possibly a second one of those during the night. Again, a discussion for you to have with your doctor. Next question. How long do people with Parkinson's benefit from levodopa carbidopa dosage? This question is worded in an interesting way. So just to be clear, people with Parkinson's always benefit from any form of levodopa, regardless of whether you take L-Dopa, levodopa carbidopa, also known as Sinemet, or levodopa benserazide, also known as Prolopa. As levodopa continues to have benefit regardless of how long you have been taking it. I have no doubt that many of you would argue with me about that because, over time, levodopa appears to lose its effectiveness. Levodopa is not actually less effective. That's not what's going on. What is really going on is that your Parkinson's continues to slowly progress over time, and your levodopa has a hard time keeping up with the nerve cell loss. So, over time, it may feel like you're not getting the same bang for your buck as you used to. Please, 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 never stop taking your levodopa just because you think it's not helping any longer. Believe me, it is, and you will feel much worse if you stop taking it. I have known a few individuals in my time here who have tried this, and they went down quickly. Not only that, when they started taking their levodopa again, they never got back to where they had been, so they never regained their basic potential of functionality. So, I said a few minutes ago that this question was worded in an interesting way. How long do people with Parkinson's benefit from levodopa carbidopa dosage? That puts a different light to this question. Because everyone with Parkinson's is different, and there are numerous dosages and times to take those dosages, I really can't answer this question, as it is different for everyone. Bottom line, when you begin to feel that your medication stops working before it is time for the next dose, talk to your doctor, as it is probably time for a dosage to be increased or to increase the number of doses you take every day. Can you take the meds more than 3 times a day? Example, 4 or 5 or 6 times a day? That's the next question. As long as you consult with your doctor before changing the number of times per day that you take your medication, and the doctor determines the number of doses that is best for you, then medication can be taken as often as necessary throughout the day. As I explained earlier, levodopa is not toxic, and the amount you take will be determined by the side effects you may encounter. I have known individuals over the years that actually take medications every hour. So, again, the bottom line is there is no such thing as toxicity with levodopa, and as long as you discuss the amount of medication and the number of doses you take per day with your doctor, and do not increase or decrease or change your medications in any way without your doctor's consultation, then medication can be taken quite often throughout the day. Next question. Will starting levodopa at a younger age increase the likelihood of being in that group of 50% of patients that develop dyskinesia regardless? I think the honest answer to this question is yes. The reason I say this is because we know that long-term use of levodopa often leads to side effects, such as dyskinesia. So the earlier you start taking levodopa, the more chance you will have of developing side effects. So the challenge for the physician is how to manage the symptoms to provide the patient with the best quality of life for the longest time, and course of dyskinesia would be disruptive for an individual still in a workplace than for someone who is retired. So you can see there is a balancing act here. Trying to balance getting the patient the best quality of life for the longest time, and, of course, trying to minimize the dyskinesia, as that could be very disruptive for the individual, especially if the individual is still working. Delaying the start of medications probably means that the development of dyskinesias would also be delayed. But, on the other hand, a younger person who probably has a family and a career and obligations like that are harder to fulfill with Parkinson's symptoms that are in full bloom, and levodopa would definitely be beneficial at this time. Again, this needs to be worked out between patient and doctor. I'm sure you're tired of hearing me say that, but it is very, very important for you to communicate effectively with your doctor. Next question. Can you safely take Mirapex daily? Mirapex is in the class of medications known as dopamine agonists, and its job is to mimic or imitate the action of dopamine in the brain. It is definitely considered to be a safe drug, but for some individuals, it can have some very serious side effects, such as excessive sleepiness, hallucinations, leg swelling, and obsessions with food, shopping, gambling, internet use, including pornographic sites, and sex. If you are taking Mirapex and have any of the side effects I have just mentioned, by all means, tell your doctor right away, as the drug needs to be discontinued under the doctor's supervision. However, if you are taking Mirapex and you find that it is enhancing your ability to be able to function on a regular basis, then of course it is safe as long as you don't have the side effects I've previously mentioned. How does alcohol consumption affect the efficiency of the drugs? If no other health conditions or medications make alcohol consumption inadvisable, people with Parkinson's may have a glass of wine or beer or a cocktail with their dinner without fear of affecting the benefit that you get from your medications, as anti-Parkinson medications are definitely compatible with reasonable amounts of alcohol. The best rule of thumb here is everything in moderation. This next question. Why is there a contraindication in terms of, or a contradiction, I should say, in terms of taking levodopa on an empty stomach versus with food? The aim of drug therapy is to get as much levodopa into the bloodstream and up to the brain as quickly as possible. If you take levodopa with food, this will only slow down this process, as the levodopa has to wait until the food gets digested before it can get into the bloodstream. So for that reason, it is better to take levodopa on an empty stomach, 30 to 60 minutes before a meal, in order to give it a head start and get it on its way to your brain. We don't want to put any unwanted obstacles in its way. This is particularly true when it comes to protein, such as meat, milk, cheese, ice cream, etc. Any foods that contain protein, as protein really interferes with how levodopa is absorbed. If this is somewhat confusing for you, you can call me and I will gladly give you a longer explanation about this. But the bottom line is, as much as possible, try to take your anti-Parkinson medications, your levodopa, on an empty stomach. The next question is, taking medication on an empty stomach causes nausea. Do you have any recommendations? First and foremost, nausea usually goes away on its own. So, if at all possible, try to tough it out and then take the medications on an empty stomach for a while to see if the nausea will calm down. If, however, the nausea continues, talk to your doctor, as there is a great medication that is available here in Canada. It is known as domperidone or Motilium. Domperidone is a medication that blocks the side effects of the nausea, but it does not change the way levodopa works in the brain. It is important to take the domperidone at least 30 to 45 minutes before the levodopa, as taking it with levodopa defeats this purpose. Another drink of tea coming up. Sorry. Thank you for your patience. Should you always take levodopa on an empty stomach? I've just dealt with this question in one way, but the actual answer is not necessarily. If you take levodopa and have never noticed any difference when you take it with or without food, then you're one of the lucky ones who doesn't need to worry about this, as not everyone finds that food makes a difference to the benefit that they get from their medication. If you don't know, then I think it's just better, again, to take your levodopa on an empty stomach, just to be on the safe side. Next question. If you don't eat protein, then is it okay to take medications with other foods, such as fruit, within a 2-hour time limit from taking the levodopa? Well, once again, the experts tell us that the best rule of thumb when it comes to medication and food is to consistently take your medications 30 to 60 minutes. I sound like a broken record, don't I? 30 to 60 minutes before your meals, or wait 2 hours after a meal before you take your medications to give your food a chance to be completely digested. Other medications, such as Pecs or any of the dopamine agonists and other medications, you don't have to worry about whether you have an empty stomach for those, as there is no contraindication to taking them with food. That rule really just does apply to your levodopa. Next question. Do Parkinson's drugs counteract other drugs I might take for secondary health problems, such as arthritis or fibromyalgia, drugs that I take for bladder control and constipation? Anti-Parkinson's medications are generally compatible with medications for other health problems, but you could check with your pharmacy about this if you're concerned. And always make sure that your Parkinson's doctor is aware of all the medications you're taking. Another question. After taking medication, what is a good daily schedule for brain and body exercise? There is no one particular brain or body exercise that is best for everyone. So, as long as you are exercising all aspects of your body on a regular basis, that's really the best you can do. Next question. Can you take amantadine in tandem with levodopa? This is a very straightforward one. Yes, you can absolutely take your amantadine at the same time as levodopa. Next question, can you or should you wean yourself off a dopamine agonist? These are medications such as Requip and Pecs, the new Pro Patch, etc. Absolutely not. You should never wean yourself off any anti-Parkinson medication. It must be done under a doctor's supervision. I completely understand that you might be having some untoward side effects, but the brain is a very sensitive organ. You must treat it well, and medication must be reduced or increased very gradually, and only doctors should be in charge of this. Is it common for Sinemet to work longer or shorter depending on the time of day it is taken? No. Time of day has no bearing on how long your Sinemet will be beneficial. Again, it's different for everybody. Again, another question about drugs counteracting levodopa. In this particular case, this individual is taking levodopa and Lyrica. I believe I've already answered this. Levodopa is compatible with most medications. Again, check with your pharmacist or your physician if you have a concern about this. I know many patients who take both levodopa, Lyrica, many other medications, and there is no contraindication to doing this. Does 3 times a day mean every 8 hours? The timing of your medication should be geared to controlling your symptoms throughout the day to keep you functioning as well as possible. This should be discussed with your doctor and should be based on you keeping track of how long your levodopa's effect lasts in your body. This period of time keeps changing. You and your doctor will have to work together to change the intervals of your drugs as necessary. So, if you're getting benefit and you're able to function for 8 hours after taking your medication, then in your case, every 8 hours will work. Most people, however, need to take the medication much closer together than that, as they find that their medication benefit use starts to wane after 4 or 5 hours of taking the medication. So again, discuss this with your doctor. Next question, does Stalevo cause dyskinesia? The class of drugs that Stalevo fits into can pose particular problems for people who do have dyskinesia, as its job is to increase the available dopamine. It is important, again, to discuss this with your doctor to achieve the right balance for you. Does amantadine help dyskinesia is another question. Yes, amantadine is especially used to treat increased movement known as dyskinesia. A question about Parkinson's drugs causing hair loss. I could not find any information to support this possibility, so I do not believe that there is a correlation between Parkinson's drugs and hair loss. How long after taking Sinemet is the peak effect realized? This varies from one person to another, and it depends on many factors, including the length of time someone has had Parkinson's. Again, it's important to keep track of this, as it will help your doctor know what is the best timing for you. Next question, what dosage is the blue levodopa carbidopa pill? The blue levodopa carbidopa pill contains 100 milligrams of dopamine and 10 milligrams of carbidopa. I've had a question about baclofen and Parkinson's. Baclofen is sometimes prescribed to treat dystonia. That's the prolonged muscle cramps. And if your doctor has prescribed that for you, then there is no contraindication to taking baclofen. A couple more questions, and then I'm going to get on to today's questions. One is apomorphine, why it is not available in Canada. Apomorphine has been available in both Europe and in the United States in an injectable format. Now it is being produced as an under-the-tongue medication, and there are currently clinical trials in Canada to look at this possible new way of administering apomorphine. Nupro has a question, that's the patch. It is a dopamine agonist which mimics dopamine. Again, it's not as effective as levodopa, but it is still effective, and it has a very stable and quite long-lasting effect. Okay, I want to get on to some of the questions from today. This question is around a gentleman who is about to have a colonoscopy. He is currently taking Prolopa, amantadine, Donepezil, amantadine, and another medication called venlafaxine. His GP has said that fentanyl and Versed are the medications to be used in this procedure, and the concern of this client is the doses of both fentanyl and Versed that are usually used for colonoscopy. Are they appropriate for people with Parkinson's? And if not, what alternatives can be suggested? This question is definitely a question for your Parkinson's neurologist. Fentanyl has received some information in the public in the past few days, inasmuch that it is being prescribed too frequently, and only your neurologist would be able to tell you whether he or she feels that this would be an appropriate medication for your husband to receive. Prior to his colonoscopy, the neurologist needs to be able to direct this particular question. And also, you have said your husband had a very bad experience with Demerol several years ago. That is very common for people with Parkinson's to have very adverse effects with Demerol. So again, this is a doctor-related question. This individual is taking levodopa 4 times a day after meals. It sounds like this individual, in fact, the wording is, have on occasion doubled intake and sometimes more, but to no positive outcomes. So this raises all kinds of red flags for me. First of all, the individual in this particular question should definitely not be doubling or taking any unprescribed medication. If your doctor is not aware of this, please do not do this and consult with your doctor. So first of all, don't double or do anything or make any changes to your Parkinson's medications without your doctor knowing. Again, the next question was around no amount of medication seemed to be helping. So again, until you start taking your medication on a regular basis, your doctor will not know whether or not your Parkinson's medications are actually helping or not. When people say that their medications are not helping, then again, it may not even be Parkinson's. If your problem states that you're speaking in voice volume, then that's a whole question around speech therapy. And if you would like to get some tips for speech therapists in Ontario, please give me a call. I would be happy to give you some direction about that. and also currently considering medical marijuana. Parkinsons Canada will be issuing a statement on medical marijuana in the new year. Until that time, I can't comment on that personally. Again, another question. I have Parkinson's. I've been monitoring if some food or drinks have an effect on triggering or exacerbating my symptoms, such as coffee, chocolate, sugary foods, etc. Bottom line with this question is that there is no contraindication with any particular food exacerbating Parkinson's symptoms. However, you may have other medical issues if you find that you're having issues with things such as chocolate and sugary foods. You may be looking at possibility of diabetic issues. These things need to be discussed with your doctor, but there's no food that particularly exacerbates Parkinson's symptoms. What is the latest word on turmeric? Well, there's been some positive work with both cell cultures and mice models. There are no human trials yet discussed on human trials for turmeric. And the latter medication that you mentioned, you're also taking amantadine. The benefits of that, amantadine is usually prescribed mainly for problems with dyskinesia. That's the involuntary movements that I talked about earlier in my talk today. Sorry. Another question. I thought I heard the doctor say, and I'm presuming you mean by Dr. Ahlskog, he recommended a maximum of 3 Levodopa a day. No, that is not what the doctor said. If the person who asked this question would like further information about that, I'd be happy to elaborate on that. The bottom line is it is not a maximum of 3 Levodopa per day. So we have a copy of that whole presentation, and I'd be happy to let you know where you can find that. So that's all the questions that I have received so far today. I'm sure that for many of you, there are many other questions. Please don't hesitate to call us if you want further information. I know that medications are particularly problematic for many individuals. We do have some excellent resources here on medication that I'd be happy to share with you. Please give us a call, and we'd be happy to help you further. Please, 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 if you have further questions, you know where we are, and we'd be more than happy to help you with any questions you may have with medications or anything else that you encounter during your journey with Parkinson's. Again, I wish you a very Merry Christmas and Happy New Year. Take care, and I look forward to chatting with you in the new year. Bye for now.